So the next ester would be testosterone, let's say, cypionate.
Cypionate is widely used in the US. It's a bit slower than the enanthate, and it's perfectly to be used once a week.
Okay.
That's the perfect
At what dose once a week?
I would say 200. Well, you're going to spike with 200 in one dose.
We can also go with 100 once per week. 100 every 5 days.
Does 100 every 5 days.
Yeah.
I would say you can do, let's say, every Monday now, 100, 150 or 200.
I guess it depends on the right ester for the right person, right? Some patients don't want to inject that frequently. Other patients prefer having it set on one exact day per week, and they know that day. Other people are better using the calendar, and they set the calendar to do every 4 days, every 5 days, every 6 days, every 7 days. I think it just depends. So have you seen a difference between testosterone cypionate and the next ester, which is testosterone enanthate?
No, they're very similar.
Yeah, they're usually interchangeable, aren't they?
Enanthate is a little bit faster. Okay.
Absorb more quickly. So would you think it gives you a bit more of a spike or a peak? Or it's quite the same?
Very similar, but in Greece we have enanthate. All I'm using is enanthate.
Okay.
Pharma grade. Yeah. And then we have the undecanoate, which is very slow, 60%.
So undecanoate is known as
the libido. It's around to be used every 2 or 2.5 months, 8 weeks, 10 weeks.
Yeah.
The longest
12 weeks.
is 12 weeks or 3 months.
So with undecanoate, we're talking it's a whole 1,000 milligrams in one go.
Yeah, this is a major
4 mils.
disadvantage for spiking the hematocrit, but also the estrogen. So you get super high the first month, kicks around second, third week, and then right before they're injecting again the 12th level at the 12th week, it's around 300. So you don't have a steady.
So this is the argument.
Spikes and then it troughs, and you don't feel well before the next injection. So you should bring it sooner, all right, around from 12th week to 8th week.
And this does happen sometimes in clinic. I mean, what amazes me about the undecanoate, libido or Avid in the US is that, it's not that new of a molecule. I mean, it came out undecanoate, as was the Andriol capsules.
But surprisingly, Andriol has a very fast half-life.
Yeah, it's supposed to work through the lymph. So you would take that, and that was supposed to slow it down.